In the high-stakes, rigorous environment of health sciences education, intense self-doubt, known as imposter phenomenon, is incredibly common. Students who were once academic shining stars often find themselves overwhelmed by strict academic standards and the heavy burden of their future careers. Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. I'm Tom Lochner of UT Health Sciences Teaching and Learning Center. Each month, we interview our educators about their research and its impact on the higher education community. In this month's episode, I talked to three of the authors of a paper titled Imposter Phenomenon in Allied Health Students, published in the spring 2026 edition of the Journal of Public Health. The article was written by LaToya Green, Emily Shannon Hughes, Pamela Lewis-Kipkulei, Wes Williamson, Myra Meekins, Chelsea Peeler, Clardly, Jennifer Hausladen, Keisha Burnett, Cassandra Christainsen, Robert Hatfield, and Carol Likens, all faculty in the College of Health Professions. Drs Green, Lewis-Kipkulei, and Mr. Williamson explore with me why imposter phenomenon happens and share practical strategies educators can use to foster safe spaces, normalize failure, and help future healthcare professionals conquer the fraud within. LaToya, welcome.
Thank you. I really appreciate it.
Pamela, welcome to you back for the second time. The trivia pieces. Pamela did our first Teach Well, Learn Well with Kelly Jo, so welcome back.
Thank you. It's good to be here again.
And Wes, welcome to you as well.
Oh, thank you, Tom. Good to be here with you.
I love this article. It's something that I've heard a lot about in my career, but especially coming to Health Science Center, it seems like it's just really amped up a lot. So I'm really interested to hear what you have to say about your article. First question, LaToya, can you just briefly summarize your paper and why this topic's important?
Yes, I surely can. Before I start with summarizing, I would just like to discuss what imposter phenomenon is. So imposter phenomenon occurs when high achieving students or people have self-doubt and fear of failure or a fear of being exposed as a fraud despite their successes. As far as our article is concerned, we looked at IP or the prevalence of IP, which is, again, imposter phenomenon. So looked at the prevalence of IP in students in the College of Health Professions. That included students in programs such as medical laboratory science, occupational therapy, and physical therapy. And we also evaluated their confidence in their academic and professional development. We took 141 students participated in this study. All of those students exhibited some feelings of imposter phenomenon. So whenever we evaluated the prevalence, we looked at the CLANT survey. That survey is a 20-question survey on a 5-point Likert scale. It's been proven to be both reliable and valid. So we use that survey to analyze or evaluate the prevalence of IP in these students. And what we found is all students exhibited IP in some fashion. 41% of those students had frequent feelings of IP, and 22% of those students had intense feelings of IP. We also evaluated the academic and the professional development of these students. And what we found with our open-ended questions were a couple of themes. One, alienation, and the second theme was self-awareness. Both of these themes pretty much highlighted the mental burden that students have, and it also looked at the coping strategies for these students.
So I'm interested in how this topic got on your radar. Is there something that happened or something that you observed that sort of pointed you in the direction of this topic?
One of my former colleagues, Dr. Emily Shannon Hughes, and I were at a physical therapy conference. It's called Education Leadership Conference. And there was one group of therapists or faculty that were really talking about IP and what the students were experiencing at their university. Dr. Hughes and I said, we probably want to look at that with our students and not just physical therapy students, but students in our college.
I'm wondering why you think that imposter phenomena seems to be more prevalent at health sciences university than at a more traditional school.
I think the prevalence is a little higher in the health science center for a couple of reasons. The first reason, I think students have a higher stake. So they're not just looking at, I have to pass a class or a course, but this is their career that's on the line. So stakes are a lot higher. I also think that imposter phenomenon is higher at a health science center versus undergrad because of all of the things that students have to maintain. Students have to maintain a certain GPA. So that's very important in order for them to stay in the program and again, hence move into their career or their profession. So the stakes are a little bit higher in that they're having to really focus on getting good grades. So maintaining good grades. There are stricter academic standards here. And with those standards, again, they're having to take a lot of examinations and evaluations that are high stakes. A lot of our students are going into the clinic and they're having really demanding clinical environments. And this puts a lot of stress on the students as well. And they're really having to synthesize all the information that they have learned didactically and put that into clinical practice. If they're not very confident in doing that, they're going to feel like a fraud.
And probably you just kind of follow up too, where students in their more traditional undergrad or general education coursework, they were probably in classes with other students who may not have been performing quite as well. Although if they're on this trajectory, kind of heading into a health science profession of some kind, where they're themselves are usually trying to perform a little bit better in those courses. And then now when they're in their professional program here at a allied health university or health science center, they're more equal with in terms of their academic performance, and they may not feel like they're shining as the way they used to. So that probably could contribute to some of those feelings where they may feel a little bit of that kind of imposter phenomenon where they no longer are the shining star, but they're a cornflake amongst cornflakes at that point.
My well said, both of you. My daughter is actually coming to UT in the fall, and she's already experiencing that. She's why are you sure that I'm supposed to be here and all that stuff? And I think that both of you are right. Is that the stakes are higher, right? If you don't pass your classes, that's your career, right? And you can't just change a major like you can at an undergraduate institution. And then your comment about just being, you've got the cream of the crop now. These are the best of their classes among their students. So yeah, when I was reading your article, I had to stop and look at your stats twice. It's like 100% of your respondents felt imposter phenomena at some point in their careers. It's like 100%, really, every one of them. Did that surprise you as much as it did me?
It did not. And I say that because the students who are accepted, they're very high achieving students. So these high achieving students really place high expectations on themselves. So it wasn't a surprise to me.
So your paper talks about some triggers for students that sort of exacerbate this phenomenon syndrome, and you talk about alienation and competing with peers replacements and performing poorly on tests as primary triggers. How can allied health programs reduce this sense of alienation that students feel?
I think they can do several things. One of the things is to really advocate for use of the mental health resources that so many universities offer. We have so many resources here, and especially our Student Success Center has behavioral health resources, and students don't always use these resources. A lot of times they're there, and the students are feeling like they need it, but then they don't even go and access those resources. So I think by encouraging our students to really take advantage of these resources is one way to reduce alienation. And another way is mentoring programs or mentors. And whether or not that's peer to peer mentors or professional mentors, these mentors can talk to them about all the things that they went through and how they really dealt with different things. And I think that could help reduce some of the alienation.
Why do you think students don't go seek the resources they have available to them? Because I know it's not for lack of knowledge, because at orientation, they talk about this stuff left and right.
And I agree with that. I think that they feel like if I have to go and get these resources, then that's saying something about me that I don't really want to say. They think that makes them look like a failure to actually have to go and utilize resources. And I think a lot of them just feel like I don't have time. I'm so busy studying. I'm doing all of these things to maintain my position here. I don't have time to take on anything else.
Yeah, and I'd follow up with that too a little bit, like where students, again, they were probably accustomed to doing well in their general education and their undergraduate work. And now they've transitioned into the more rigorous health science profession program that they're in. And they may not be performing as strongly as they once did before. And so they're just not accustomed to having to seek out those other forms of assistance to help them move forward. Some of that could be some of the emotional health. Some of that could be utilizing instructional and study aids that the campus may offer in other forms so that they can get to where they're more successful. Because we've seen students who, in their past education, they've never really had to study to do well in a course or in the past tests. And then all of a sudden, they get here and it becomes more rigorous and they don't know how to study. And I think that can contribute to some of that imposter phenomenon a little bit. But at the same time, they're also just not accustomed to having to seek out assistance. And so they're either hesitant or just not sure what that's going to be for them.
I think a lot of times hold a lot of students back. Just as Pam said, if I acknowledge this, then this makes me look a certain way and for my weakness.
Yeah. Peer pressure also plays into that because if my peers know that I had to go and seek help, what are they going to say about me?
Yeah.
Right.
I'm interested in your pride issue because even as grown adults, we still have that problem, right? The number of times my wife says, go see a doctor. And I say, I don't need to see a doctor. And, a week later, I'm at the doctor. And the doctor says, you should have been here a week ago. I want to read a quote from your article and ask you to respond to that. You said, students described managing emotional experiences by internalizing feelings, minimizing them, or sometimes completely withdrawing and not trying to avoid being exposed as wrong. Are there strategies that we as educators can teach our students to avoid these behaviors?
I think that there are several strategies that we can implement. And one is maybe looking at the class culture and making sure that the students see the classroom as a safe space where they can really come in and discuss things and know that there's someone there that really wants to help them. And another thing is that we can look at class discussions and make sure that when we're having these discussions that we're trying to include everybody and that we're encouraging them to think deeper, not just, hey, you that always answers the questions, answer this question, but trying to make sure that everybody has an equal opportunity to be a part of those class discussions. And one of the things that I try to do all the time is to actually just encourage them to ask questions. A lot of my students don't like to ask questions because they're so afraid that they're going to be wrong. And I try always telling them there's no such thing as a crazy question. If you want to know, you have to ask, and that I don't always know what it is you don't know until you actually ask me. So I think by encouraging questions and making sure that they feel that we're going to answer the question without putting them down, without making them feel crazy because they asked the question, I think that would be a really good way to help them avoid those feelings.
I used to do a lot of cold calling, and over the last couple of years, I've stopped doing it because I've had students say, I'm really afraid in your class because you just call on me. And if I don't know the answer, I'll look a certain way. So instead of doing a lot of cold calling, I'll just ask the question and ask people to raise their hand if they want to answer. And if I see someone's lips moving, like they're trying to say the answer, or if I see that they're saying the right answer but not loudly enough, then I will call them out. But I think a lot of times with the calling, students were very anxious because they didn't want to be wrong.
I've also done some things like the think, pair, share, where I know I'm going to ask these questions in class. So I give them an opportunity before I ask them to get in a group and to discuss it. And then one person from the group represent, but each group has to answer. But whoever feels the most comfortable answering after they've discussed it and talk about it, that person can answer. So then everybody has participated. And maybe they're not the one coming up and like speaking about it, but they did speak about it in the group. So I think that also helps as well.
And the nice thing about that is, I mean, if people are feeling like their peers are much smarter than them, having those conversations, they can believe that what they have to say is just as valuable as what the other people in the group are saying.
Yes.
So it sort of minimizes that feeling.
I think that it's good to kind of remind the students too that this point in time with where they're in this transition into their chosen healthcare profession, they're still learning the profession. So this is a learning environment, not where you're expected to be an expert yet until you're actually practicing. And so I think kind of putting that in the context for them to help understand a little bit that that's kind of the goal of why they're here, and to encourage them to ask questions and to create an environment where they do feel more comfortable asking questions. And sometimes with my students, they're trying to throw their hands up right when I'm in the middle of a sentence, or I want to finish a thought when in class and I want to get that done. So I give them the hold on a second, and then get into the question that they're asking and kind of reassure them that that was a good question, and then to kind of help them find a way at the answer with that question. And I'm sure that both LaToya, you and Pam have probably had cohorts of students where you always have a couple of students who just pick up everything pretty quickly and can answer things very fast. And so I sometimes will have a side conversation with that student or those students like, hey, I know that you know this, but maybe if we could give the others a chance to kind of chime in, because I would imagine that when always having somebody else who seems to be right on top of their game with everything and just picks it up super fast, that it makes the others feel a little bit more like an imposter, and kind of contributes to those feelings for them. So just kind of balancing out that with the exceedingly exceptional students to kind of give them an opportunity to let the others have their voice and to grow while they're in the class too.
So your paper also talks about anxiety and depression among students. I'm interested in how you find this balance, because out of necessity, as a program, you need to be strict. You need to have high standards for students. You have to have strict academic and performance standards. How can you maintain these strict academic and performance standards when you're taking patient safety into effect and balancing that with the anxiety and depression that students feel?
Yeah, that's a really good question. And some of the things our students do have to do things like they have the exams that LaToya mentioned, where they have, what do you call them? Those exams where practical exams where they're having to do things and perform right in front of people, and encouraging them to realize that the classroom is that safe space, because if you make a mistake in the classroom, we can correct it. We can talk about it. We can figure out what you did wrong and fix it then. But you can't do that in the clinic when you have a client. So really giving them a lot of opportunities to do those practical exams where they actually get that hands-on experience, but even having them do it in groups where they are all looking for an answer and they're discussing it and figuring it out together so that they don't feel I'm put on the spot right now. And then I think that that can kind of keep some of that depression and anxiety at a lower. Some other things is also something that I've started doing recently is making sure that my rubrics are very clear, that they totally understand what it is that I want from them so that we take the guesswork out of it. I used to want them to be really creative, and I've kind of taken some of that back because when I expect them to be creative, they don't always understand exactly what that means. So also started doing something that I look at as video instructions where I talk to them about this is exactly what I want when you're doing this. And then I also mention last year when we did this, some of the students messed up here. And so rather than having you mess up here, here are some suggestions for what you can do so that you don't make the same mistakes that they did. And like really talking about it and making sure that everything is clear. And then the last thing that I've been doing is putting discussion boards within the course. And not like the discussion boards where I'm asking questions, but there are discussion boards where the students can actually, anything that you're not clear on, anything that you want to know, just put it in there. And I guarantee them that I'm going to look at it within a specific amount of time. So they know they're going to get an answer to their question. They feel safe putting it there, and they know that I'm willing to help. But I also encourage other students, if you know the answer to this, go to the discussion board and answer it as well. And then that way everybody's clear and we're all on the same page.
So some of the things that you talked about really is about humanizing the learning experience and how do you create relationships with your students in order to help them reduce their anxiety and depression. And I think that's a good segue into my next question is that your research also talks about how faculty awareness of student stress and understanding that it's there also plays a role in student success or failure. How can teachers and clinical supervisors be trained to spot and support the students struggling with this imposter phenomenon?
Well, I think, Tom, with students who are experiencing imposter phenomenon, there can be some kind of outward, I hate to use the word symptoms, but I guess signposts that can kind of point you in that direction. Although it may not be limited to just imposter phenomenon, because some of these behaviors that you may see out of your students could come from different personal reasons or other extenuating circumstances. But noting students who come in and start having change in their appearance, where they start to look a little bit less well kept, more disheveled, maybe some grooming issues, or while in class, you see them where there's a change in their effect, where they don't engage with their classmates or with you in class as much, and they tend to gravitate more towards some avoidance in terms of eye contact and not making eye contact and just kind of that kind of withdrawing back a little bit. So I think seeing some of those cues and using those as a trigger to engage and have conversations with those students to kind of find out what may be going on with them and seeing if that they're could be experiencing some imposter phenomenon that way. Because with some of the highlights that we pointed out, where if they start to say, I just don't know if I belong here, I'm not sure about this, I just kind of feel so alone with them, my group of students here, then that kind of points towards some of this imposter phenomenon, if that's what manifests out of the conversations we have with them.
I would like to add, there are other things that I guess some people look at as positive, but perfectionism is another thing. So if this person has to always get things correct, I need to have a 100% on every practical, every written exam. That's another warning sign. I would also say another warning sign would be self-criticism. And so we talk about constructive feedback with our students and doing other reflections as well. And so a lot of times we do not only peer evaluations or peer assessments, but we do self reflections as well. So just really focusing on those things and spotting those warning signs of perfectionism and self criticism, I think is important.
That's really interesting. I would have never thought about someone whose work is never good enough as an indicator that there's some imposter phenomena going on there. Really interesting insight. Your paper also talks about mentorship programs and how a mentorship can help alleviate feelings of isolation. What specific qualities or structures would make the most effective mentorship programs for these students?
I think with mentorship programs, there's probably a few different strategies that could be taken to getting one set up and to implement. I think first could be having faculty advisors sign for the students and let them kind of develop relationships with the students in that regard. But in other mentorship program strategies, that something that could be a little bit more effective when using peers. But if you have students in your programs that are multiple cohorts, and so if you have students who are in their second or third year, they could serve as mentors for new students coming into the program and kind of help guide them a little bit and kind of share some of their experiences with them and develop relationships with them. So I think that may help to alleviate certainly some of the isolation feelings by setting up those mentorship programs. And then as another option too, though this is takes a little bit more effort and work to bring them in, using some of your clinical faculty that may be on available through your program or other, alumni who may be out there who are working not too far away from where your program is, and to set up mentorship programs with them where maybe they meet periodically, like say once a month, just to kind of talk about the program and what they're experiencing and to get reassurance from that alumnus that has been through it and can let them know that they're on the right track and they're doing fine. So I think there's a few different strategies. So this sounds a little bit more informal in terms of how it could be set up, but I think those are some of the options that could be out there for them.
I was just going to say, when we have mentors, I always encourage the mentor not to just tell them all the good things that you've done, but tell them about the mistakes you did.
Oh, yeah.
And even in class, I tell them about the mistakes. The first time that I had a client and we fell, and we talk about it. And it's like I talk about how I felt and what I did. And we talk about what I could have done and things such as that. And a lot of times, I encourage them to make sure they're telling them about those things, but then tell them about something good so they realize that I made mistakes too. And I still made it. I'm still here in the profession, and you can do that as well.
Mhm. Like probably humanizing yourself, because I imagine most students probably come into a program and see their faculty as the experts in their profession, and letting yourself become more humanized that you make mistakes and even maybe create some that are somewhat intentional in the classroom environment to give them an opportunity to detect that and feel a little bit more confident and realize that no one's perfect.
Exactly.
Yeah.
And I think normalizing struggles and failures are very beneficial in learning. And if students know this, realize this, I think it will decrease some of those IP feelings. And I cannot really remember what was stated at graduation, but was it the chancellor or Dr. Boyd? One of them stated something about failure, embrace failure so that you can learn and grow. I really like that statement.
So your research really focused just on allied health. We've talked about allied health students, but I imagine that there are probably things that other health professions can take from your research as well.
And with imposter phenomenon, it's certainly not limited to just allied health professions. When we started getting into this a little bit more, I think it was kind of this up and coming topic that we were picking up on that we got into with this. And I think that this imposter phenomenon is probably more pervasive in other professions than what we realize, and probably even than what those students realize, or probably don't even know what imposter phenomenon is when getting into it, and not realizing that that's where their feelings of self-doubt emanate from, is that they really are capable, and just having to realize that they're in a state where they're learning, and that's when it's okay to make those mistakes. And you don't have to be perfect, but as you get into your profession, you would hone your skill, and that'd be a little bit more to make them an effective healthcare professional as they get into it. But I think that certainly if we're seeing this in allied health professions, certainly I would imagine that other students in other health professions are experiencing very similar sensations too.
I know we found various studies about nursing,
Medical professionals like doctors and
dentistry, all those, but we really didn't find a lot of literature on allied health.
Okay.
Mhm.
So you've come out with this great paper that shines some really important light on this imposter phenomenon. What's your next steps for your research?
We would like to expand by not only looking at the College of Health Professions, but other colleges and programs at UTHSC. We've also discussed maybe venturing outside of our university and looking at other universities and colleges, especially health science centers. We've also discussed just bringing in faculty and clinicians, or investigating faculty and clinicians, and seeing if the amount of time, the prevalence, and then once we see the prevalence, see if there's a correlation between the time of practice and the amount of IP that's present.
And then as time goes by, we learn more about imposter phenomenon and its prevalence. It could be opportunities to look into research, though we haven't talked about this yet, I don't think, but looking into what could be some interventional strategies to help students overcome some imposter phenomenon and kind of really put those to the test and kind of see what becomes more effective and most effective at helping students overcome some of that.
Very interesting. I'm looking forward to those articles and having you back here to talk about your additional research. Well, LaToya, Pamela, Wes, thank you for this time. This is great, a really interesting and important conversation. So I appreciate you taking the time to come over here.
thank you, y'all. Thank you, Tom.
And that's this month's episode of Teach Well, Learn Well. I'm Tom Lochner of the Teaching and Learning Center at the University of Tennessee Health Sciences. Until next time. And that's this month's episode of Teach Well, Learn Well. I'm Tom Lochner of the Teach Now Learning Center at the University of Tennessee Health Sciences. Until next time.